Hi, everyone. I'm Katie Sacra, and joining me today is Melissa Bryce Campbell. And no pressure at all to be the first webinar of 2021. We are here today, and we're going to talk about the Global Foundation for Peroxisomal Disorders. And we have a few different objectives that we want to cover today. We're going to share about our mission, history, programs, a little bit about our committees and events, how we support our families, about the diagnosis, the terminology, impacts, test, and then identification and management. And then also identification and outreach, what we're even doing today, making sure that we are raising awareness and helping everyone know that we're here and that we have these children who have this rare disease. We're also going to talk about newborn screening, misdiagnosis, professionals that serve our children. And then also we're going to talk about overall rare disease awareness and support for individuals who have rare disease. And so I'm Katie Sacra. I'm the GFPD Family Education and Engagement Liaison. In the corner of my slide, there's a few hats in different colors. And that's just because I feel like I wear a lot of different hats. Over the years of presenting, I kind of don't know how to introduce sometimes because in the one picture you'll see my son and I smiling and cuddling on the couch, and that's very much number one of who I am. I'm mom to TJ, and my son TJ has a peroxisomal disorder, which is a rare disease that causes deafblindness and other multiple disabilities, as well as complex health issues. And then the next picture is my husband and I standing in front of the Capitol. And that's just to kind of show the advocate that I am, because we advocate for so many different things that we're just really passionate about. And the very next picture is something that I'm going to talk about and share throughout the presentation today. And I know it's really small, but what it is it's saying what I'm pausing for. And what I'm pausing for in this picture is undiagnosed families. And that's really important to me. And you'll learn that today, I think, as I share about my experience of not having support and struggling to find a correct diagnosis of a rare disease. And then finally, the other picture is one I just took last Friday because it was my son's 21st birthday. And as you will learn today, on our next slide, you're going to see right away, actually, that this is a disease that really, it's fatal young. And most children pass from this at a young age. On the screen, you're going to see my son. You're also going to see Melissa's daughter, Jenny. And then you're also going to see a little baby boy. And his name is Alon. And he passed away from this disease at the age of 14 months. So something that you're going to hear throughout this entire presentation is this severity that really has a very large range. And so peroxisomal biogenesis disorder in the Zellweger spectrum affects 1 in 50,000 children. It's genetic. We have the word mutations here, and you may hear us throughout the next hour switch out the word mutations for variants, and they are the same thing. These mutations or variants in the PEX genes is what causes this disease. And so PEX1 mutations are actually the most common cause. My son has one of the most common that we know of. Clinically, our children present very differently. As I just shared, my son turned 21 years old on Friday. And then you have Alon here just directly beneath him in this picture, who died at the age of 14 months. And he was very severely affected. But that doesn't mean that my son, who's 21, is mild either. So there's a lot of questions and a lot of research that's taking place. We've come a long way and we still have a long way to go. So you may see seizures, leukodystrophy, hearing and vision loss, the combined losses, feeding difficulties, liver dysfunction. And these are just to name a few. Melissa's actually going to dive into a lot of the symptoms a little bit later on, but I just wanted to give you a quick little picture of how rare this is and what a variety of symptoms you may see.
Thanks, Katie, for getting us kicked off. And thank you to the Southeast DeafBlind projects for having us today. We're so excited to share our mission, and tell you what we've been doing over the last 10 years to help families and hopefully find some ways that we can partner in the future. So as Katie mentioned, I'm the mother of Jenny. Jenny was born in 2008, and we searched for 2 years to try and understand what was going on with her. So our diagnostic odyssey was about 2 years long, which for a mother, a first-time mom, a brand new baby, that was difficult for me.
Hey, Melissa?
Yes.
This is Marilyn. Can you do me a favor and speak up just a hair more, okay? Thank you.
Yes, I will. I saw that note. Can you all hear me now?
A little bit more, just a hair more.
Okay.
Thank you.
Yeah. So we went through a very long diagnostic odyssey to figure out what was going on with Jenny. And finally, at 21 months old, we received the diagnosis of a peroxisomal disorder in the Zellweger spectrum. That was in the year 2010. Next slide, Katie. So, what did our life look like when Jenny was with us? So Jenny had, can you all hear me now? Pretty good? Okay. So Jenny had a lot of medical management, a lot of things that we had to take care of for her on a daily basis. She went to PT and OT and speech and feeding therapy very regularly as part of our life with her. She also was able to attend preschool and kindergarten, and she had about 25 words and signs. And so she was able to communicate with us, which is something we worked very, very diligently on with her. And as you can see, she was also a big sister to Jack and Avery. Katie, next slide, please. So Jenny did pass away in April of 2015. She had a multitude of urinary tract infections, kidney infections that caused her to really just struggle the last couple of years of her life. So she passed away when she was about 6.5 years old in 2015. And, it's, I can't believe it's been 5 years. It feels like forever ago. And then it also feels like a minute ago that she was here. So now, I, along with Katie and others, are helping to keep her memory alive and keep the memory alive of all of the children that have passed away due to peroxisomal disorders and other rare diseases. Next slide, Katie. Okay, so as I mentioned, I am one of the co-founders of the Global Foundation for Peroxisomal Disorders. We began this organization in 2010, and we're now in our 10th year, which is hard to believe. Our little baby organization is moving into the preteen years, and so it's exciting to see what we've been able to do, and to continue partnering with as many folks as we can to get these kids what they need. So our mission is to improve the lives of individuals with peroxisomal disorders. We fund research, we champion scientific collaboration, and we empower families and professionals through educational programs and support services. Katie and I are going to talk about a few of those today. So the GFPD is truly a global organization. We began that way in 2010 because we knew peroxisomal disorders were rare diseases, and we knew that we couldn't segregate ourselves from the rest of the world, and that we really wanted to be a resource to any family that needed us. So we have tried to be inclusive and reach out beyond the borders of the United States to find new families and to help them. So we do currently have families in 39 countries around the world. And we've worked for the last 10 years to build up a really robust group of researchers and collaborators at various academic and government research institutions around the world. So we have 21 research collaborators and institutions. So if you're like me, you may not know exactly what a peroxisomal disorder is. You may have forgotten what a peroxisome is from your biology classes in school. And so we're going to help remind you of that today. So to start with, peroxisomal disorders are rare diseases. So any disease is considered rare if it impacts fewer than 300,000 people in the US. So that is the US definition of a rare disease. This disease is also genetic. So it is caused by gene variants, and I'll talk about that in a minute. And this disease, peroxisomal disorders, also impact all major organ systems in the body. So a peroxisomal disorder in the Zellweger spectrum means that the peroxisomes in your cells are not working properly, are absent, or are severely decreased. We also have, in addition to the peroxisomal disorders in the Zellweger spectrum, we also have single enzyme protein deficiencies, and those are D bifunctional protein deficiency and acyl-CoA oxidase deficiency. I'll talk about those in a subsequent slide as well, because those disorders are very similar to the Zellweger spectrum. And so several years ago, we said, you know what, these families need some support as well. We want to support them. So we broadened our mission to allow our organization to take on these other families as well and support them. So peroxisomes are necessary for cell function and normal brain development. Katie, next slide. So how does someone get a peroxisomal disorder? So this lovely graphic that the GFPD had done kind of helps to illustrate that. And at the top, the dad and the mom are both represented with and everyone has 2 copies of their PEX genes or any genes in their body. So we have one working copy and one non-working copy of that gene in our bodies. And so I'll continue explaining this. I hope it will make sense. But I had a copy of the working gene and a copy of the non-working gene. My husband also had the copy of the working gene and the non-working gene. And so when we put those 2 together, we each had a 50% chance of passing on either that working copy or the non-working copy to any children that we had. So additionally, I want to clarify that it is possible to have 2 copies of a working gene, as you can see in the carrier category. So we were able to, with this graphic, I hope that we're able to illustrate a little bit about how this happens within families. And I think it's important to note that it's important to note that every pregnancy has a 1 in 4 chance of being impacted. So not that you could have 4 children and you would have 1 child that is an unaffected carrier, 2 children non-carrier, 2 children that are carriers, and 1 child that is affected. So we are happy to send these slides out later as well. Katie, next slide. Okay, so what is a peroxisome? Peroxisomes are an organelle in every cell of our body, and peroxisomes make important things happen in the body. And when they are missing or absent, when they're absent or not working well, or there's a decreased number of peroxisomes, that causes a peroxisomal disorder and the impacts that we're going to talk about here in a few minutes. Next slide, Katie. So symptoms of a peroxisomal disorder. Katie mentioned this a little bit a few minutes ago, but we have, and as I mentioned, peroxisomal disorders impact nearly every cell in the body, or every organ system in the body. And so a lot of things are impacted because peroxisomes are in every cell of our body. So what do we see when a patient has a peroxisomal disorder? These children are born and often have difficulty feeding. They can have neurological impacts like seizures, or as Katie mentioned, leukodystrophy, which is white matter changes in the brain. They can have difficulty with liver function, sensory neural hearing loss. So it's not conductive hearing loss, but it is sensory neural hearing loss, and vision issues as well, including retinal dystrophy and optic nerve abnormalities. Additionally, bone issues can be a part of this disease. Kidney issues can be a part of this disease, and then just a global developmental delay. I want to highlight that we are still learning so much about peroxisomal disorders. We are still learning what, some of the symptoms are that our more severe patients on the spectrum experience, and our more mild patients experience as well. So it's important to know that this disease, we're still learning about it. And it's important for us as an organization to be actively engaging our families so that we can help build that body of knowledge about this disease. Next slide.
I'm going to jump in and add just quickly to that sensory neural hearing loss, that a lot of our children are actually born hearing. They pass their newborn screening, and at some point they often rapidly lose their hearing. So it can easily be missed when there's so many other health situations going on.
Mm-hmm. That's a really good point, Katie. The progressive nature of this disease makes it difficult to find and to manage. So this next slide talks about management of peroxisomal disorders in the Zellweger spectrum. And, so first we have symptoms that an individual may experience. For instance, growth failure or poor feeding, as I spoke about previously. And then what are the specific tests or exams that would be done to help further elucidate that, to help further, understand what's going on in that individual's body. So a feeding evaluation, evaluation of vitamin levels, as well as fatty acid evaluation. And then the treatment is often treatment with fat-soluble vitamins, so A, D, E, and K, We also encourage families to have their individuals that are impacted by a peroxisomal disorder to have them take an omega-3 fatty acid. And sometimes our patients do get a G-tube to help, a gastrostomy tube to help with feeding difficulties. So although there is no cure for peroxisomal disorders, there are lots of things that we can do to help these kids have a good quality of life. And that is what we've focused on as an organization. That's what we focus on as parents of children with this disease, children and adults with this disease, is using what we have to help manage their symptoms. Go on ahead, Katie, to the next slide. So this slide I wanted to add because it kind of highlights some of the implications that people don't normally think about with medical management. And a lot of these issues impact the family overall. So, the first one is respiratory support. So for many children on the severe end of the spectrum, they have difficulties maintaining their respiratory function, and often some of these children that are more severely impacted can be helped with oxygen support, with support of a vent or trach vent. And so in the past, those options really were not offered to families. And we're making sure that families know that they're out there and could help provide some better quality of life, not only for the child, but also for the whole family. I don't know if you've ever seen someone in respiratory distress, but it's not pleasant, and it can be traumatic for the whole family. So, looking at that as a support for the whole family is something that we want to help our families do. Palliative care, the GFPD is a big advocate for the expansion of palliative care for all patients. In the past, there has been such a, what's the word I want to use here? Misunderstanding about the difference between palliative care and hospice care. And I think that's starting to dissipate a little bit now. I hope that we're able to be part of that conversation that also, brings to light that palliative care is not only for the patient, it's for the family as well. Carrier screening is something that the GFPD has been really involved in for the past 10 years. Carrier screening can help to identify if a carrier or an affected patient, if their siblings are also carriers. So several years ago, when we had just received Jenny's diagnosis, my brother and my sister both had carrier testing done to find out if they were carriers of this same mutation. It turns out they are. And their spouses, though, however, are not. So luckily, they were able to have children without needing much in the way of family planning advice. So that takes us to our next bullet, which is family planning. So for families like Katie's, like mine, that are impacted by a peroxisomal disorder, there are options now to help those families have healthy children if they would like to. So those options include pre-implantation genetic diagnosis, with IVF, and we have a lot of families that have gone through that and had healthy children as a result of IVF. And then, of course, genetic and biochemical prenatal testing with a CVS or an amniocentesis, you know, we have families that have older children that were doing that 25, 30 years ago. So, you know, that is something that still exists, and a lot of families make use of that too. So we want to be a bridge between the information that families are getting and helping them think about those further implications down the line. But you know what all this means is that these families need emotional support. They need help, and we're here to fill that gap for them. All right, so let's dive deeper into terminology. Put on your scientist hats because you're going to need it. Again, peroxisomes. 10 years ago when Jenny was born, I did not remember what a peroxisome was. And I had not heard of a peroxisomal disorder. Today, we're going to try and simplify that for you so that if you see a patient, if you are providing technical assistance to someone that has deafblindness, that has some of these characteristics as well, you know, we want you to think of us and help direct that family to us if possible. So there's a lot of terminology here. One of the things that we have struggled with over the last 10 years is that the terminology has changed, and what is recommended in terms of terminology has also changed. And then finally, as we're learning more about peroxisomes and peroxisomal disorders, we're finding that there are actually some diseases that did not have a genetic background for, that now we know have a peroxisomal background. So we've added those diseases into our support. So two main categories of peroxisomal disorders. There's peroxisomal biogenesis disorders, and then there are also single enzyme protein deficiencies. So of the peroxisomal biogenesis disorders, the GFPD provides support for those families that have a patient in the Zellweger spectrum. Of the single enzyme protein deficiency disorders, we provide support for families that have a patient with acyl-CoA oxidase deficiency and also D-bifunctional protein deficiency. We do not provide support for the other two diseases that are listed here, which are rhizomelic chondrodysplasia punctata,
also known as RCDP.
RCDP. And then additionally, X-linked adrenoleukodystrophy, we do not provide support for. Those two diseases have their own support groups and support organizations, and we are happy to partner with them when we can on certain projects. So again, at the bottom of this graphic, you may hear some of these terms thrown out as in meetings that you may attend: Zellweger syndrome, neonatal adrenoleukodystrophy, infantile Refsum disease, or Heimler syndrome. So those disorders are all peroxisomal disorders in the Zellweger spectrum, and we provide support to all of those. We are part of the group that is leading the charge to help both families and patients and professionals and medical providers understand that this is all one disease. So Katie's going to talk about severity here in a bit, but it's important to note that we want to be inclusive, and this disease is difficult to manage. It's difficult to predict. And so we want to give those families the best opportunity at receiving treatments and supports that we can get them. And this more inclusive terminology, that facilitates that better support for families.
Another piece to the terminology that I've shared before and I continue to share is that I think that that's part of, it's a barrier. The terminology itself can be a barrier to support because it's changing. Melissa and I, when our children were first diagnosed, we were told different terminology than what exists today. And so just wanted to point out really quickly that you may see the XALD. And as Melissa just shared, that's something that the GFPD will absolutely partner with and help, get you to the supports, but that's not one that the GFPD directly provides support for. And that's, again, XALD. And then you may hear the term NALD, which is neonatal adrenal leukodystrophy. And that's an old term for the Zellweger spectrum disorder. And then just one more quick example would be if you look at these older terms across the bottom, the infantile Refsum's disease, which is IRD. There is an adult Refsum's disease, which is actually a single enzyme protein deficiency. And so there are a lot of medical professionals that don't realize that these are in separate groups even, and that they're not related, even though they're both peroxisomal disorders. And so that old terminology isn't just not being used and it's part of the spectrum, it's still being used. We're recommending that it not be used. It's been recommended for quite a few years now. But then additionally, you have these other diseases, other types of peroxisomal disorders that have such similar acronyms and language. So I really think that this can be a barrier in itself. And that's why we're so grateful to be able to talk, and raise awareness on presentations like today to help you know that this is what we support. If you see any of these terms across the bottom, our slides are available, then know that that's us and that we can provide support to these families. So that is part of what I'm going to talk about next, which is identifying patients and families. And in addition to learning those terminology changes, 3 ways that we do that is newborn screening, the scientific advancement that's happening, and education and awareness like we're doing today. So I'm going to talk a little bit about newborn screening and the basics. Newborn screening is just a few drops of blood that are taken from a baby's heel and placed on a card that is sent to the state's newborn screening lab. Newborn screening does not diagnose diseases, but it identifies which babies need additional testing to confirm or rule out these diseases. And there is an image on the screen of a little adorable infant foot that has a little blood spot that's being tested. So newborn screening and peroxisomal disorders is something that we are really trying to raise awareness about, because there is a newborn screening test that's happening that is mainly talked about for remember the XALD, the X-linked adrenal leukodystrophy, that we don't provide direct support for, but that newborn screening test actually identifies the individuals who we do provide direct support to. It detects elevated VLCFA, which is very long chain fatty acids. Being able to have this screening and identify these individuals earlier eliminates that lengthy diagnostic odyssey that Melissa and I both and so many other families have experienced. It also affords potential for early therapeutic interventions. If you look back and remember some of those management of the symptoms that Melissa was talking about, if you don't know what someone has, you may not even know to look, and then you can't manage the disease as well. All of this comes back to quality of life. And that's going to directly have a benefit to the family, to the patient. And then there is a picture on this slide, and it's actually of Dr. Mosemi Bose. And If you remember way back when we first started, there was that little baby, Alon, who was 14 months old, who, when he passed away from a peroxisomal disorder, that was her son. And here she is in Brooklyn, New York, and she is presenting in 2019. And she's presenting to a room of medical professionals and scientists about the Zellweger spectrum being able to be identified in this newborn screening for X-linked ALD. Because this just shows you that was just in 2019, and most of the professionals in the room had no idea that this was something that was going to be picked up. And then when it did, that there was even treatment guidelines, that there was the GFPD to help these families. So this is something that's very new that we really appreciate the opportunity to be able to share about. As I shared, I'm going to give a little pieces of my experiences. My son's 21, so I feel like I could talk all day. I won't do that to you. But our diagnostic odyssey was really lengthy. In 2000, my son was born, and I immediately noticed something wasn't right. We were not a severe case where he was, rushed to the NICU. He just had some small minor things that actually were picked up on ultrasound when I was pregnant and were dismissed. Within a few months, 3 to be exact, we knew that there was some pretty severe vision issues going on. He had surgery on his eyes by the age of 6 months. By the age of 12 months, they were scanning his head and looking to see if there was a tumor. We had quite the experience that first year trying to figure out what's going on. But we were so focused on the developmental delays and the vision loss that we didn't realize that he had gone deaf, because like many of our children with this disease, he passed his newborn hearing screening. So finally, at the age of 18 months, he was diagnosed with an unknown type of peroxisomal disorder. We did not know what the variants, or also known as mutations, we didn't know them. So there was some information that wasn't clear, and they just said, we know it's a peroxisomal disorder, but we're not sure which type. And if you remember back, Melissa was talking about the 2 different main types. They actually were leading towards the wrong one back then. So at the age of 18 months, he was finally diagnosed correctly. And before that, we had a lot of misdiagnoses. He was in the hospital at this point. He had unresolved bilateral pneumonia. He had an enlarged heart. His liver was extremely enlarged and very abnormal levels of the liver function. He also was failure to thrive and had lost so much weight, he just dropped off the growth chart completely. So he had a lot going on at the time. And I share this with you because I want you to hear that sounds like a pretty sick baby, and he was. And yet he just turned 21 years old. So it really shows you that, he had his first seizures at the age of 8 months. You can have all of these different clinical manifestations that happens, the different symptoms, and it doesn't necessarily mean that the child will not have prolonged survival. So that's something that's just really unpredictable and so difficult for our families, including myself. By 2005, we finally received a correct diagnosis, and that was through just persevering and being able to finally reach out, get the right doctor, and have some additional testing done. And we were able to find the variants that caused this. In 2006, my husband and I, so 6 years after our son was born, we were able to know which variant I carried and which one my husband carried. Like Melissa, our family also did the carrier screening to be able to identify who was at risk and who could have this information so that they could make the best decisions for their, building their families. It wasn't until 2010, when my son was 10 years old, that the GFPD was founded. 2011, 11 years old, we attended our first conference. We met the first child that was like ours. We met another family that had a child like ours. We went over a decade, and I struggle to find words, which is hard for many people to believe because I'm a talker. But I struggle to this day to find the words to be able to describe what it was like before the GFPD and after the GFPD. And I know that that's why I am so passionate about making sure that our families receive the supports that they need and deserve, because I went for so long being so isolated and not having that support. And that also ties into why I'm passionate about people who are undiagnosed and eliminating this diagnostic odyssey, because it's one thing even to have a foundation, but it's another to not even have a diagnosis.
And Katie and I are hoping that as you all are learning about this, if you are working in early intervention or other areas where you may be seeing those undiagnosed patients, that you will think about the hallmark symptoms of peroxisomal disorders that we're talking about today. The low tone, I know I didn't go into this on the slide about Jenny's diagnosis, but, what were things that we saw when she was a baby that were concerning to us? So she was very floppy. She was my first baby, and she just, kind of flopped there. And we have this picture of me holding her, and she just has no muscle tone. But of course, as a first-time mother, I didn't see that. I just saw my beautiful baby, who her arms were everywhere, and her legs were everywhere. And then, some other things that we noticed, talking about the progressive nature of the disease. Jenny passed her newborn hearing screening, just like TJ did. But several months later, she was still a baby. My husband and I were at a restaurant eating outside close to a busy city street here in Tulsa, Oklahoma, where I live. And an ambulance went by, and it was so loud. And she was sleeping at the time, but Brant and I looked at each other and thought, how is it that she didn't even move, didn't stir? Nothing, something's going on here. And so she was, I think 6 or 9 months old at that time. And that was when we really started digging deep to find out what those issues were. And then, again, she struggled to learn to feed as a baby. So that was concerning for me. I tell my mother this all the time, but without my mother's help, I know Jenny would have had a G2 much sooner than she did. My mother really worked with Jenny to help get her to latch on and learn to breastfeed. So that was, looking back, that was crucial for her development. So as you all are learning about this and thinking about this and seeing individuals with deaf blindness, I would encourage you to think about these symptoms and think about patients and individuals that you see that may be undiagnosed. Do they fit any of these qualities? And can you help point them in the right direction?
And so even if you have a diagnosis and you're working with families that have another diagnosis that's caused the hearing and vision combined loss, I still want to share this lengthy diagnostic odyssey because think about that early identification and how crucial that is for families, not just from that early intervention and the different strategies that can be in place, the different supports for the individual, but for the family as well. How stressful it is, just the emotional roller coaster that we're on. There's so many reasons that we need to help identify and connect these supports to these families earlier. If you have a rare disease diagnosis, 6 to 8 years is the average time it takes to get an accurate diagnosis. And that's any rare disease. 50% people affected by rare diseases are children, 50%. And 3 of 10 children with a rare disease won't live to see their 5th birthday. So these statistics are not about our peroxisomal disorders. This is for rare disease. And so if you look at these lengthy diagnostic odysseys and you look at these statistics, it's even more crucial for us to help these individuals be identified earlier.
And Katie, if I can jump in, Katie, I was going to mention that there are over 7,000 different rare diseases. There are only 3,000 common diseases. So, you know, rare is not rare. 1 in 10 people are impacted. And Katie's going to talk about that.
You can go on. So if you look at those numbers, and then you, like she said, there's over 7,000 rare diseases that exist today. And then you take those numbers and you realize how many are children and how many won't see their 5th birthday. And we really need to create this. We need to build this awareness and create change and make sure that these families are being identified. 1 in 10 Americans, 30 million in the US, 400 million globally, are affected by rare disease. 80% of rare diseases have identified genetic origins. 50% of people affected by rare diseases are children. 95% of all rare diseases do not have a single FDA-approved drug treatment. Rare diseases impact more people than cancer and AIDS combined. And 3 to 10% of all hospitalizations, regardless of their age, are related to a rare disease. So I ask again, how rare is rare disease? It's really not that rare when you look at these numbers. So we talked a little bit about newborn screening, and this slide is just to show, it's another graphic that the GFPD created to help raise awareness about how a baby today may receive a diagnosis of a peroxisomal disorder. And so if you look on here, there's, on this graphic, there's baby 1, and then there's on the other side, there's a column that has baby 2. Baby 1, as you can see, has a lot of lengthy process that pretty much Melissa and I have already shared about. And that's what we went through. We were baby 1, where you can see there's a lot of bubbles and little text boxes showing all of the different processes that we went through. One that's not included on there that should be added is how many misdiagnoses you may go through. So this is actually a short version of the long process that we go through. And then there's baby 2, which you can see is a much shorter process. There's less little text boxes showing that process. And that's because baby 2 was born in a state that included newborn screening that would identify this baby at birth as having a rare disease. And so Aiden's Law is the name of the newborn screening that we continue to mention, HR 534. Newborn screening can be done successfully. As I believe we've shared, there's so many reasons why we want to make sure that newborn screening is happening. But for this specific disease, Aiden's Law, which is the XALD, it actually will save these boys' lives. And so we're identifying individuals with peroxisomal disorders through this test. But the reason, sadly, that they are able to advocate a little bit better is because they're saving lives. And I don't agree, but, we have to advocate that we are improving quality of life. We're identifying these families earlier, and we know that that's very important. But as advocacy goes, you have to be able to show something a little bit bigger. But we're very happy that many states are doing this. And here is a map. So again, we'll be sharing these slides so you can see, if you're watching, what states are actually, in the process of testing, which ones have just recently started testing, which ones will be starting testing in 2021, which states are mobilizing efforts to have this happen. So this this graphic has, it's a map of the United States. It's color coded. And so it will be able to show you. If you have any questions, you can reach out to Melissa or myself afterwards about this. But we're very happy to see this map finally start to fill in these different colors and see that testing is increasing. So for those of you who are listening today that are providers that serve our children, you may very well see an increase in this diagnosis in your state.
And good job to Kentucky, Tennessee, North Carolina, and South Carolina for either being in process or starting pilot projects for newborn screening. When Marilyn mentioned Puerto Rico, it made me think, I don't think we have data on Puerto Rico, and I would love to know that. So for anyone that's online today from Puerto Rico, we're going to look for that and get that info, because now I'm intrigued.
And so talking about all these different ways to identify families and individuals with peroxisomal disorders, I wanted to show the patient registry. The GFPD maintains the largest database for individuals in the world that have peroxisomal disorders. And as you can see, when the GFPD was founded in 2010, we started with 48. In 2017, it grew to 442. In 2018, it grew to 481. And in 2020, we were at 557. Between newborn screening, awareness and outreach, and increased genetic testing, we don't know where we're going to be in the next few years, but we know this is going to steadily increase. So ways that we support our families is one of them is advocacy, and our advocacy initiatives at the GFPD. We have a lot of different ways that we do this. One is Rare Disease Day, which is coming up, Rare Disease Day and Week, and we also have Pause for the GFPD, which is every October 5th. And then we also have legislative initiatives that are relevant to our community. And a lot of times you will find that what's relevant to us will be relevant to a lot of other communities as well that have the combined hearing and vision loss. If you look at, we bulleted a few, Allie's Act is on there, and that's pertaining to hearing devices being paid for by insurance. The Cogswell-Macy Act for interveners and being able to have the supports that we need for, in the education system. The Rare Disease Caucus, anybody who has a rare disease diagnosis is going to benefit from that. Newborn screening, we only mentioned, the Aiden's Law and how it would pertain to our families, but it actually identifies several other diseases as well. And then NIH and FDA funding is crucial. As you saw, there's not very many FDA-approved drugs for rare disease. And in this picture is a group of us we were in DC on Capitol Hill, which due to the pandemic, we will not be doing this year, but this is something that we do each year. Outside of the pandemic, we take a team of families with us to DC to meet with our representatives and advocate on these different initiatives, or these different legislative initiatives. Melissa, you look like you wanted to add something.
No. Katie has become such a wonderful advocate. Advocacy is kind of where my heart is. I love sharing my story and using my voice to help spread awareness. And I'm really excited with all the work that we've done in the advocacy realm the last few years. And, looking forward, who knows what 2021 will bring, but I'm hoping that there can be some movement on some of these things advocacy-wise that we've worked on for so long, like Cogswell-Macy, and Allie's Act is relatively new, but something that is really important for our community and many others. So the GFPD has a multitude of scientific initiatives. We have a three-pronged approach, really, to our programs. So advocacy, as Katie has just mentioned, scientific initiatives, and then family support initiatives. So we have worked really hard over the last 10 years to build a scientific community that can help look at, what can we do to help improve quality of life for patients. So some of the things that we've been involved in include a partnership with NCATS, which is the National Center for Advancing Translational Sciences. NCATS is part of the National Institutes of Health. And we've been doing that partnership for about 3 years with them. They have been helping us do some drug screening projects. So we're looking at small molecules that could be helpful to patients with a peroxisomal disorder and help improve that peroxisome function. And then additionally, we also have a scientific grant process where we have, along with our partners, doled out about $1.3 million in the last 10 years in scientific grants. So that comes from other family foundations and another patient organization as well. The RCDP group has helped us to fund some research. So, we have been the largest investor to date in this field, and I'm looking forward to continuing that and seeing if there are things we can do to help improve the quality of life of our patients. And then on this slide, you'll see two really cute little mice. Katie and I took this picture about, what was that, Katie? 5 years ago, maybe?
2013. I think it was 7 years ago. Brace yourself.
Wow.
We were actually fortunate enough to be at Johns Hopkins, and we were at an event for the GFPD, and we were able to go and go to the lab. And yeah, we took this picture.
So the teeny little mouse is a mouse that has a peroxisomal disorder. And this mouse has been genetically changed so that it has a PEX1 mutation. And you can see that it has, two PEX1 mutations. And so you can see how much smaller it is compared to its litter mate, its sibling, that is only a carrier of this disease. So that was a big aha moment for me and Katie, because, I think we saw both of our children in this cute little tiny mouse. And, it's amazing. I never thought I'd be interested in mice. And now I love mice, and I appreciate everything that they do for science. So, our mice work, our mouse studies, development of other mouse models and models of rats with a peroxisomal disorder is really important for us to continue to be able to test new medications, test new drugs on these mice, so that we can see if there's any sort of adverse reactions, and so we can study how the mice are impacted by these various small molecules or medications. And then beyond the mice, we also help facilitate scientific advisory board meetings for our scientific advisors. We have a group of 10 really dedicated scientists in the US, Canada, and the Netherlands that give up their time to help our patients. And so it's really important that we continue to foster those relationships. And these folks really are the leaders in the field of peroxisomal disorders. That, they've been around for 20, 30 years. They've seen the field develop and seen, a large number of patients with peroxisomal disorders. And so they have really just a wealth of knowledge that we can all work together and learn from. And then finally, we also encourage our families to help build the body of knowledge about peroxisomal disorders, to help us really have good participation in our natural history studies, so that we can learn what kinds of symptoms are impacting individuals with peroxisomal disorders, what kind of treatments are working to help those symptoms, and what should we know about, what should we tell future families, future patients to be watching for. This is something that's crucially important in management of a complex disease.
Another initiative that we have is the Family Support Initiatives, and a few of those that would be included would be support groups, and these may be online. They are virtual. We actually say we have hybrid support groups now. Krista Olson, who many know from the South Carolina DeafBlind Project, co-facilitates with me for the last few years a group that now includes families from 4 different countries in the family-to-family community support group. We also have the equipment exchange. We have many reasons that people are providing equipment, whether it be somebody doesn't use anything anymore, or their child may have passed away. I know Melissa, her daughter Jenny, has, my son even actually, his cochlear implants, some of the pieces of his cochlear implant and his backup processor are actually her daughter's. So being able to share, and the GFPD supports us sharing that equipment with one another. Regional meetups on the off years that we don't have the Family and Scientific Conference, webinars, virtual roundtables, peer-to-peer direct mentoring, which is just something that I'm really passionate about, because that's where you get support from somebody who just really, truly gets it. Our family guidebook, which is new this year, and the Family Navigators program, and family-to-family communities. I'm sorry, I already spoke about that one. And Sensing Connections Bereavement Support Group is something that we began a year ago, but that was not the first time we started bereavement support. Bereavement support has been something that I really feel sets the GFPD aside from many other organizations. We make sure that our families are supported when their children are here living and after they have passed. And then we also have our website. So just to go quickly through a little bit about our conferences that we have, this is the 2019 conference. There's a few pictures of parents exploring and trying different types of technology that they may want to use for their children. We have a picture of a volunteer sitting on the floor playing with a child that has a peroxisomal disorder in our child care rooms that we provide. And then there's also a picture of someone with goggles on their forehead, and that's because they had just participated in one of our simulations of having vision and hearing loss. And actually, she's a genetic counselor who just presented in the other room that day, and she was just so moved by the sessions that we were having. She stuck around and she participated. She'd never heard of this before. And the quote that she shared with us was, "The sense of unity and community that I felt during my few hours here is truly inspiring. Everyone here is so knowledgeable and willing to join in a conversation." And so the GFPD Family and Scientific Conference this past year in 2019, I say past year, it's like 2020 was a blur. So the year before, in 2019, we did something a little bit different. And we titled it as Expanding Our Reach. And we did this to expand our reach to a diverse group of professionals beyond the professionals already working in peroxisomal disorders. Empowered these professionals through collaboration and innovative sessions to improve their ability to promote and provide better quality, wide-ranging care to rare disease patients. And what this means is we basically had a lot of scientists and a lot of medical professionals, but we wanted to branch out and bring in all professionals and bring them all together to work with the families and the individuals with peroxisomal disorders. And that is how you're able to just make sure that we are improving quality of life.
And something that we have already mentioned matters to the GFPD is inclusion. So this picture was taken in 2011 at our very first conference. And even back at our very first conference, we were supporting bereaved families. We wanted them to be included in the conference sessions. We also had separate sessions for them as well, dating back to 2011. So this is something that has been a part of the GFPD for quite some time. You know, in addition to parents and bereaved families, we also had individuals with peroxisomal disorders as well that were able to communicate. So we have this emerging patient group of patients that perhaps thought that they had Usher syndrome in the past, and then had genetic testing and found out, no, they don't have Usher syndrome variants. They do have peroxisomal disorder variants. And so they are now finding the GFPD. And one of our strategic priorities is to continue to find those patients and provide opportunities for them to connect with one another and be involved in research. We also have a large group of grandparents that attend our conferences. We have special sessions for siblings, as well as the scientists and researchers that have been the backbone of our organization for the last 10 years. And again, as Katie said, in 2019, we were really excited to welcome a wide variety of professionals. Next slide, please, Katie. So within those sessions for professionals, we had physical therapists, occupational therapists, speech language pathologists, DeafBlind consultants, O&M specialists, orientation and mobility specialists, family engagement coordinators, and we plan to continue this at our 2022 conference. So last year, in the epic year of 2020, we decided that we probably needed to hold off on our 2021 conference until 2022. So last year, we quickly made the decision to not push to have a conference in 2021. And I have to say, I'm really glad we did that. So our next conference will be in 2022. Location should be announced sometime this spring. And I hope you all will continue to stay engaged with the GFPD, and we'd love to have as many of you there at our conference in 2022 as are able to be. Next slide, Katie. So I know we're running short on time, but this is one quote that I want to read because I think it's really important. And I'm going to skip to the second paragraph. This is a quote from one of our scientists in training, if you will, at McGill University in Montreal. And she said, "I have been attending these meetings for years, and each time learned something new about the patient and the caregiver experience and values. I now understand that the silver bullet is anything that allows for more moments of joy and inclusion." So this scientist in training was really, saying, after having these experiences at our conference, after meeting the families, any support that we can provide them is better than nothing. Anything we can do to increase joy and inclusion in their lives is better than before. So that's what we're working toward. Go ahead, Katie.
And I wanted to add that this scientist actually, she attended the customized employment presentation as well. So we really encourage, and I'm looking forward to the next one, of being able to see all of these different professionals just come together and learn about all the different areas that us families we already know. We live all of these different areas. All of these things matter. We're not tunneled into certain areas. And so it's really been exciting to watch the professionals come together and just see all these different pieces and how many different ways our lives are affected. And then once the conference is done, the challenges don't stop. So the support cannot stop. The GFPD provides ongoing support 24/7 all year long. We work to share resources. We help identify needs, and we help identify supports. And that may sound odd, but a lot of times we don't even know what our needs are. And I list this as two different ways. One, a family may not even realize that, this is something that somebody can help me with, but we also don't know what policy changes need to happen and what to advocate for unless we realize that this is really impacting a large number of people. And there's a need for this. Assist in navigating the different systems and facilitate connections. And when I say facilitate connections, I'm talking about medical professionals that may have never heard of this disease, being partnered with somebody from our scientific advisory board, facilitating DeafBlind professionals with an education team that's serving a student that has a peroxisomal disorder. And so we're really just facilitating so many different connections. And we're doing this in advocacy with the science, with the family support, that three-prong that Melissa was mentioning. All of this is ongoing, and our level of support has really just increased. And all of that family engagement and identifying the needs and the research that's taking place, it all just keeps, going to the future, to these really amazing changes. We're able to collect data, and then we have publications. We talk about symptom management and being able to improve quality of life. But the publications, just from this family engagement, getting this data, identifying these needs, we're able to publish documents like the treatment guidelines. We just recently had a brand new publishing of symptom prevalence, which is showing professionals and families that a lot of the previous publishings about symptoms were inaccurate. And, seizures, for example, are much more prevalent in this disease than once thought. Bone health, things like that. So these publications really do matter. And you're not going to have these without collecting this data, without engaging with our families. When you have all of this information, you can build awareness and you can advocate, and that's how we make change.
So, we've been doing this for 10 years now, Katie and I and the GFPD. We're by no means experts, but we have pulled together some practical tips that we think can be helpful for families that have a rare disease, that have a peroxisomal disorder, and for the professionals that help care for them and provide training to their families and resources. So one of the things that we believe is most important is getting your DNA results. So that is, finding what genetic variants or genetic mutations a patient has. This can be done very, very inexpensively compared to what it was 10 years ago. Even 5 years ago, even 3 years ago. The cost continues to drop. And there is interest at the federal level to help look at ways that this can be made even more cost effective, and some universal coverage for testing like this can be done so that families aren't waiting and for a result, and that they have answers and they can provide better options and better treatments for their kids quickly. So another practical piece of advice that we have is for families to share publications that relate to their disease with their professional teams. On the GFPD website, we have a wide list of scholarly articles that we have gathered that are all good pieces of information for families to share. These, are peer-reviewed pieces that, it's not Google, it's credible information, and that's what we want to share with people. And then, finally, kind of a two-part is that we want families to know that severity of the disease is not set in stone. And no one really knows what the course of a peroxisomal disorder is going to look like. There are so many variables. And so we want to encourage families to keep their minds open, encourage providers to, really look at how they can help these kids achieve the most and have the best quality of life. Okay, Katie.
And the last bullet on here is just know that, doctors and nurses, they're the medical professionals, but you will know more about these disorders, especially when you are a rare disease patient or family member. You're going to learn so much more. You're going to be talking with others who get it. And that's why we talk about the importance of those publications, because until that happens, you're just a mom that found another mom on the internet, and but you will know more. And if you look back to many slides ago with Dr. Bose talking to those medical professionals in New York, and that was only in 2019, and many people had never heard of us. And so that's quite common. And these are just a few ways to get involved with the GFPD, participate in our conferences, webinars, join a committee. We have several committees. You can, that's all on our website. Again, we have Pause for the GFPD, Big Awareness Day. We would love for everybody to be involved. And then Rare Disease Day. It's a great way to support families and individuals who have rare disease. You can look on the internet, you're going to find lots of zebra and stripes. And I really encourage you to get involved. It's a great way to show your support for the families that you provide support to. And then also hosting a fundraiser. And here's a few resources that we listed. Most of these pertain specifically to rare disease and not just peroxisomal disorders, but can really be helpful to any family who has a rare disease. Global Genes, NORD, N-O-R-D, Child Neurology Foundation, RDLA, which is going to be a great place to go and look for things like Allie's Act and those different policies that we're trying to move forward to help individuals with these sensory losses. Every Life Foundation, another great one for advocacy. And then also the National Alliance for Caregiving, because we are caregivers. So thank you for having us today.
You guys are wonderful. This is Marilyn speaking. Thank you so much. And I'm just looking to see if we have any comments or questions. Donna, can you review the chat box for us?
Hi, this is Donna. I sure can. I'm happy to do that. There was one question in the very beginning that I'm going to pull back. And let's see where it is. So Allison had asked Melissa, when you were sharing, when both of you were sharing your journey, she said you seem to have identified the concern earlier. How did you know something was out of the ordinary? When did you first know that?
Yeah, so I think that goes back to that story that I told about us sitting on the restaurant patio. I just had this nagging doubt that wouldn't leave, and I don't think of myself as an anxious person, but it felt like I needed to dig deeper and continue asking questions. And so I encourage families, caregivers to follow that intuition, because it's usually right. And it was in our situation, the floppiness, the difficulty feeding early on, we thought Jenny should be hearing, but that ambulance went by and she didn't move. So I think a lot of it just has to do with intuition, and following your gut about your kid. As Katie said, you're going to be the expert. families that you all work with, you know, many of them are the experts. They know their kids better than anybody. And so as professionals, you know, support those parents, ask those probing questions that can help them think outside of the box and think about, you know, their experience and how, you know, what else they might need to be looking for. It's really a detective game, truly.
And I always reference our experience with puzzle pieces. I think a lot of us use the puzzle pieces because we had so many and we didn't know what the end picture was going to look like. And we just kept getting these pieces handed to us. So when my son was born, we noticed right away something didn't seem quite right about the position of his feet. And so it just continued to escalate with different little puzzle pieces or symptoms. And another part of that would be that I wanted to share. You know, we follow our gut, but sometimes, you know, we get really focused on one thing and it's hard. And so just give yourself permission to say, you know, I didn't know what I didn't know. I had no idea my son was deaf until he was 2 years old. I had no idea. We were so focused on everything else that was going on with his vision and not meeting developmental milestones that it just, I had no idea. We didn't even know to look that direction. So sometimes, you know, we get these little pieces and we look, but honestly, that's why we're here to build awareness, because when you see these developmental delays, the combined vision and hearing loss, the liver dysfunction, those are the things that we really, you know, are hallmark symptoms that we've been talking about today, because we didn't know that those puzzle pieces fit together to show us a peroxisomal disorder.
Thanks, Katie, and thanks, Melissa. Your responses are always great. Such a wonderful presentation, full of information. And this is Donna speaking to let everyone know if you want to know more, please contact Katie or Melissa. Their information is right there on the screen. They're both super nice and would love to talk to you if you have any questions.